cities have a very high air pollution levels. Dr. Swarup, I also wanted to, earlier we were talking about how there are very high costs to lung transplant surgeries, and no government hospitals offer it right now, and it's a huge challenge for those who require it.
Absolutely. So obviously lung transplant, because it needs a lot of expertise, it needs an organ to be procured, it needs a lot of tests to be done before as well as after, and plus the need of immunosuppression, long ICU stays. These patients are usually in hospital for say a month or so. They would be in the ICU for about 15 days. After lung transplant also, they would need interim ECMO support. Some of these may need dialysis as well. So all of these definitely add up. So the actual cost which comes around to somewhere in excess of say 40 lakhs. Now, obviously, certain places in India, we have government providing some bit of support to that. And I hope that,
Right.
in the course of time, the whole of India and the government in all states, help the transplant program in general, because most of these transplants are quite costly. Not every common living being would be able to afford it. But yes, with some amount of support coming in, and I'm sure there...
What kind of support, if you could just tell us?
Maybe something like, say, for example, if the cost is around 40 lakhs, if the government can put in, say, 25 lakhs, I mean, obviously, I'm not the right person to talk about this. I'm very bad with policy.
We spoke about it earlier, but you're saying that certain states are providing the support.
Yes, certain states like maybe down south, Tamil Nadu and all, these are the states which do fund transplant program. An amount of financial support is provided to the recipient if he is below a certain segment or a level. Now, the same could be expanded to include all of the states in India, and that would definitely benefit the transplant program in a lot of states.
Definitely now that more and more people are, requiring these surgeries because of these transplant surgeries because of COVID. I'm running out of time. Hemlata, last word to you. Dr. Swarup was talking about the need for more people to come forward and, be open to organ donation.
Yes, very much. It's a dire need situation. Not many people are